Well, good morning, everyone. For those of you who don't know me, I'm Steve Kalina. I'm the president of the Minnesota Precision Manufacturing Association. I want to welcome you all today. Just some quick housekeeping. We've got some upcoming events to pay attention to. On May 19th, we've got a partnered event with Printing Industry Midwest, PIM, for a young professionals group at Inbound Brewery. May 24th, Mate Precision is holding an MPMA tour for their 60th anniversary. June 23rd, Success Computer Consulting is doing a presentation on the theory of constraints. And then, of course, on July 26th, we've got our golf tournament at Bunker Hills in Coon Rapids. So last year, we, I think, ended up having about 40 or 50 people on our waiting list for the golf tournament. So I'm guessing it's going to fill up pretty quick here. We've got people already joining pretty fast. So if you're interested, please sign up soon. So for today's program, for a couple of years now, we've been looking at options for a healthcare plan. A lot of our members have been asking about options and ways that we can help as an association. And so we looked at a few different options and are really excited about what we can offer today. So there's a few other manufacturing associations around the state that are currently partnering in a program very similar to this. So it's proven to work. It's a lot of manufacturers are seeing the numbers look really good for them. There's a few different features that you'll learn about today, but from everything we've seen, the program, the plans look really good. So I'm excited to start partnering now with Hahn Financial Group. So Luke Hahn will be our presenter for today, and again, Luke has been really integral to working with manufacturers around the state on programs such as this, and knows the industry, knows insurance, of course, and has a lot of good stuff to share with us today. So throughout the presentation, feel free to use the chat function to ask questions of Luke. And after he does a short presentation, it'll be open for question and answer afterwards. So feel free to ask any specific questions to your business or about plan questions that you have. So with that, I will turn it over to Luke Hahn, and thanks for joining us today, Luke.
Well, thanks for having me, Steve. And one second here. Perfect. Well, good morning, everyone. As Steve indicated, my name is Luke Hahn, and I'm the Health Division Manager at the Hahn Financial Group. And it's my pleasure to be spending the next about 12 to 15 minutes with you to share some of the details and advantages of the MPMA Employer Health Plan. I do ask that you can feel free to type questions throughout the presentation or ask questions at the end, whatever you're most comfortable with. But let's start to get into some of the information on how this plan might be one of the more effective ways to influence the rising cost of healthcare for both yourself and your valuable employees. We're also going to look at how this might help lower cost and increase employer control. But before we get into those details, who exactly is the Hahn Financial Group? We are your collaborative partner with your association, the MPMA, meaning that we work for you. We are registered under the Securities and Exchange Commission, the SEC, as a registered investment advisor, which means that we are, by definition, fiduciaries, and we bring our fiduciary standards and service model to your health plan. We provide self-funded health plans with stop loss, retirement plans, wealth management services for entities across the country and across many different industries and business types. Our focus, though, is that of fiduciary guidance and fee transparency, both of which are hardly and rarely heard of in the group healthcare world. Not only will our fee structures be transparent, but we'll help guide you in the right direction that's most beneficial for you and your business. If this isn't a good fit, I'm going to be the first one to tell you it's not a good fit. Our service area does include anywhere in the United States, and having this national footprint allows us to serve you and your employees regardless of where your company is domiciled or where your employees might live or travel. Now, in order to understand how the MPMA Employer Health Plan may help you lower costs and increase employer control, it's first necessary to understand, well, what's wrong with the current group healthcare market? And could we be more obvious than to start with healthcare costs? Small group health plans are currently rated with a system called the community rating. And this system was created with the Affordable Care Act, and the concept is simple. Your premiums are dictated by the average health of the community that you live in. A study done by Kaiser Family Foundation found that 20% of the population in America accounts for 80% of all medical expenses. That means that 4 out of 5 groups are likely paying more than they need to for their health care under this model of the Affordable Care Act. Further compounding this issue is that of fee transparency, or the lack thereof. Costs go up, yet you never really know how your premiums are being spent or being used. We believe that you must be able to inspect that which you expect. Blind trust is not a good strategy. As mentioned previously, 4 out of 5 employers may be paying too much for their healthcare under the traditional model. Well, this is the opposite of free market capitalism. Just like you wouldn't want to run your business on a subpar business model, we don't think your benefits should be either. Which then brings us to the issue of profit margins for insurance companies. After a lot of this previous pain and suffering and higher costs, the insurance companies still try to make their legal profit margin. There's nothing wrong with that. Every business needs a profit. But there might be more efficient ways to handle this that don't cause that potential losing proposition for both employers and your employees. The solution may be the MPMA employer health plan, where we establish a self-funded health plan with stop loss, employer by employer. This is a strategy that's already used by the largest companies in the United States, and it truly can combat the previous problems. So what's different with a self-funded plan compared to a traditional fully insured plan? One of the first differences is in how your premiums are used. In a traditional health plan, all premiums are paid to the insurance company, and you don't have any control over how those premiums are spent, or even if your premiums are being used. In fact, in most years, not all the premium you send to the insurance company is actually spent on medical expenses. So what happens to those premium dollars in those years? Well, the insurance companies keep those as part of their profit margins that I mentioned earlier. Again, not an issue, they're a business just like anybody else. But shouldn't your premiums be helping your business? And that's where the MPMA health plan starts to look and feel a little bit differently. As previously mentioned, the plans are fee transparent, so you can start to track how your dollars are going to be spent on your plan. You will notice that your same premium is now being split between 2 different accounts. One account contains fixed costs, such as your plan administration and, most importantly, paying for your stop loss insurance. But the other account pays for claims throughout the year. This claims account is variable based on how claims are actually accumulated for your group, but this is the account that in 4 out of 5 years, not all the premiums collected are spent. And in the times that there's dollars left over at the end of the year, that claims account would be returned to your company as an asset. And that's always the fun part to talk about, getting dollars back that you normally aren't accustomed to. So what happens in that 1 out of 5 years on average where you spend more money than was collected? And in a high claim year, there's no money left to be retained. And in those years, your plan looks and feels just like your fully insured plan that you're used to, where your only financial risk are your monthly premiums, no more, no less. This is due to the stop loss insurance you paid for in your fixed account or on the left bucket on your screen. The stop loss begins right where your premium ends. There are no surprise bills and no fluctuation on your premium amounts throughout the year. This is a strategy that does provide you with plenty of advantages of self-funding while providing you the security to run your business as usual. Now, I would like to point out that this is not an association health plan, as has been popular in the media recently and been reviewed. An association health plan has many of the same concerns that the current market has that we talked about, where premium rate calculations are pooled, employers don't benefit from the transparency or retention of dollars. The model available through the MPMA is different. We bring this efficiency of self-funding to each individual employer, meaning you get to benefit from your own program. Now, historically, self-funded health plans with stop loss were only available for the largest of employers. But through economies of scale, we can now write self-funded plans for groups as small as 2 across the United States, and 2 in 45 states and down to 5 in the rest, but in Minnesota, we can go all the way down to 2. So what does this mean for a member of the MPMA? This means that we might have a strategy for you. Now, what are the advantages of the self-funded health plan beyond what we've already talked about? It ultimately comes down to the first 2 talking points: lower costs and more employer control. The claims account, you also retain unused dollars left at the end of the year, kind of creating new cash flow environments. So we'll talk about that briefly as well. But first, let's touch basis on lower cost. Lower costs are achieved through effective plan design. One of these examples is of how premiums are calculated. Remember that under the current community rated model, 4 out of 5 groups may be paying too much for their healthcare. The self-funded program focuses on helping those 4 out of 5 groups achieve lower cost. Premiums are now calculated using the average health of your group rather than that of the communities. This enables you to have a plan unique for your organization while accurately representing where your group stands. And who benefits from these generally lower premiums? Well, of course, you as an employer and your employees. There also tends to be a lower cost of administration when using a self-funded model because we piece together the 2 appropriate services, the third-party administrator who handles all the day-to-day items, and the stop-loss carrier providing that protection to run your business as normal, while still being price transparent across the board. The effective design then enables us to limit the carrier profit margin and risk charge as only a small portion of the premiums the actual carriers. So let's say under a traditional model, an insurance carrier wants to raise their rates by X amount, well, that affects your bottom line by that X amount. Under our model, the insurance is only about 30% of your overall premium, so it's much harder for that one aspect of your program getting a rate increase to dictate your entire bottom line. We'll also be able to show you how much is being sent to the insurance carrier, how much is being sent for administration, and how much is being sent to your claims account. You'll be able to track this on a month-to-month basis to see if there's any potential for retention of dollars or how claims are processing throughout the year. We do believe that there's a difference between having something done and having it done as well as it could or should be done. And we believe that self-funding through the MPMA employer health plan can be that difference. Well, each employer is going to define how or what they want to control in different ways. We find that your health plan should mimic your business and that you can control the benefit design to appropriately recruit, retain, and reward your employees. To start, you'll have complete control over plan design and benefit structures. This will enable you to offer the appropriate benefits that your employees want and need. If you have a current program, we often start by mimicking your plan design and then customizing from there. We have many value-added programs built into our health plan to help you navigate the healthcare world more efficiently. One of those is called Healthcare Blue Book, and this actually lets you shop for your healthcare much like you'd shop for a lot of other things. It does both quality and cost metrics and gives you a good idea of trying to receive more efficiently priced healthcare at a high-quality rate. Other value-added programs are teledoc, telemedicine, there's wellness programs, and many other options. One of the greatest things that we do, though, is the choice of provider access. We do have those traditional options available through PPO networks, but our most favorable option tends to be called reference-based pricing, where we allow your employees to go to any doctor, any facility they want to as in-network, all claims processes in-network. But ultimately, the best financial control you can have is your claims account. You as an employer will retain these dollars at the end of the year. If there's no dollars left in that account, you don't owe anything more. Your only financial risk are your monthly premiums, just like you're paying anywhere else. The MPMA employer health plan starts to become your business within your business. And this business is efficient in most years, first for that tendency for lower cost, but secondly, for that tendency to retain unused claims dollars. If you take one thing from this presentation, or just remember one thing, remember that you have options through the MPMA. Remember that you have a choice in the benefits you offer, and those benefits can also help your business succeed. Not only can the MPMA employer health plan help you gain more control, but it may also help you benefit your employees through generally lower premiums and better plan design. You'll also gain your access to your unspent claims dollars, creating that financial control for your organization. Please don't hesitate to contact us or Steve directly for a referral. The process for a quote is simple. We only need basic census information on your staff to get started. And if you have a current healthcare plan, a copy of your benefit structure, so we can try to do an apples to apples comparison. My goal is to show you what can be offered here and then for you to make an educated decision based off the saving strategies or advantages that might be shown. And we believe that you owe it to yourself and to your employees to explore the health plan opportunity that the largest companies in America are already doing. Now, if there's any questions at this time, I'd be happy to address them or work with you one-on-one privately.
So Luke, one quick question that we get from a lot of members right off the bat is, you know, if their renewal is mid-year, okay, call me back in 6 months. What do we have? Do most companies have options if they're middle of their renewal year?
Yeah, so if you're on a fully insured health plan currently, you actually can leave your plan at the end of any month, and we can start a plan the first of any month. If you're currently on a form of self-funding or level funding, we will want to look at the contract that you signed to make sure we're not causing any harm or unfavorable outcomes from that. But if there's an opportunity to save on premium, on cost, or improve plan design, we don't believe that you should have to wait. And so we can also offer deductible credit in most scenarios so employees don't have to start over on their benefits if you decide to make a mid-year transition. Okay, perfect.
How about, I know we had a couple of members that were asking about, you know, some of the existing benefits they have and you know, premium type plans, you know, access to the Mayo Clinic, things like that a lot of employees like to have. Are you typically able to still provide a lot of that access?
Absolutely. Mayo Clinic, a lot of our TPAs actually have direct contracts with because they're such a big center of excellence across the United States. But ultimately, our most favorable plan designs allow for your employees to go to any doctor and any facility as in-network. Regardless of where they go, the administrator is going to process those claims under in-network benefits.
All right, so how about the $1 million question? What happens when you get that $1 million claim?
Yeah, and that's a great question, and it can happen. As soon as the last penny out of your claims account is spent, again, the portion of your premium goes into your claims account to pay for expected claims. But as soon as the last penny out of that account is spent, the insurance carrier takes over all claims and pays them at 100% on an unlimited basis. All of our programs use A, which is excellent or higher rated insurance carriers, and they're all essentially Fortune 500 companies in the United States. So then the next question that tends to come after that is, well, what does your renewal look like if you've had $1 million claim? And that's where our plan really starts to look and feel different, is because our underwriters care much more about the prognosis of that claim rather than just what happened. So a lot of the traditional insurance carriers, they'll try to make up some of those lost dollars. And there's nothing wrong with that. You know, they're trying to run a business. Our underwriters really look at what is the expected claims cost of that procedure going forward. So let's take a $1 million baby being born for an example. That baby's not going to be born again, and likely everything will be fine with that baby. So that claim isn't going to have a negative impact on your renewal compared to, say, a stage 4, stage 3 colon cancer, something that's going to be multiple years of treatment with a poor long-term prognosis. The underwriter's goal is to appropriately predict claims cost for the following year, not to make up previous dollars.
So in regards to that, then, if you have those kind of scenarios, are you better off, worse off, or the same with this kind of plan versus other traditional fully insured plans?
Yeah. So if you're in the smaller group category, you always have that safety net of falling back to the fully insured market without penalty, without cost increases. You'd rejoin right where you left. So if there's an opportunity to have more efficient plan design and savings and better opportunity, even if this plan might only work for, let's say, 2 or 3 years until something major like that comes up, that's still a great opportunity for your plan to take advantage of. Our retention rate is north of 90%, so we don't have a lot of that turnover that you might see with the fully insured market trying to shop plans year over year. But ultimately, we do cast a wide net when we're looking at our options because each underwriter is going to look at risk differently. So just because one underwriter might think this is a high risk opportunity, another one might see it in a different light.
So just a reminder, anyone that has any questions, feel free to ask them via the chat. So with, you know, you mentioned the leftover claims and, you know, you mentioned having, you know, leftover dollars at the end of the year. What exactly does that mean? And what kind of, I mean, you're talking about significant dollars. What can you do with those dollars? What are the restrictions?
Yeah. So the claims dollars left at the end of the year, that account is funded to about 120% of expected claims. The reason they go above is it helps keep costs lower on the insurance side, and it gives more opportunity for dollars to be returned. So on an average year, you would expect about 20% of that account to be left. So let's say there's $100,000 in there, there'd be 20% left, or 20,000 that could be returned to your organization. Those dollars only have to be used for the common benefit of the employees that they were collected for. And this is due to collecting the premiums on a pre-tax basis originally. So a couple ideas of what I've seen other employers utilize that for is, most commonly, it will be used to help pay for premiums. And you can actually offset your own costs as an employer with those dollars. I've had a concrete company out of Sioux Falls. They bought new work boots for all their employees. We've had people bring in dietitians or buy gym memberships for their employees. As long as it's for their common benefit, you can utilize those dollars for that purpose.
All right, thanks.
Those dollars are also not at risk the following year, so it's always a year-end type compartment.
Question came into the chat. Are you able to have an HSA plan with these plans?
Absolutely, and I'm a big proponent of HSA plans. We're also financial planners at the Hahn Financial Group. I'm on an HSA plan myself. And then if you have more than 5 employees, we can also offer 2 plan designs. So you could offer one copay option for your employees and then one high deductible health plan option as well. We also have HSA vendors available, but we also recommend to maybe work with a local institution if appropriate.
How about deductibles and out-of-pocket max costs? Are those customizable?
Absolutely. We have benefits ranging from a very rich $0 deductible design all the way to your minimum value plan. But what you'll find with a lot of our carriers is their minimum value plans aren't actually cheaper than some middle of the road plans. And that's due to the efficiency of, they have a lot of benefit designs, for example, at a $3,500 deductible range and a $4,000 deductible range. So they can charge less administratively for those plans compared to these one-off plan designs at a $7,000 deductible. So oftentimes we can keep richer benefits at a lower cost.
So, I mean, everything keeps sounding good. I mean, I've heard your explanation, I don't know how many times over the last couple of years, and I keep asking the same question, like, what's the catch? Like, I mean, you know, better plans, lower premiums, cash back potentially at the end of the year. Can you just quickly, I know you already said it, but can you reiterate, like, why is it not a catch? Why does it seem to be so good?
So really, it's back to the future. Medical underwriting, which is how we get the average health of your group, was the norm before the Affordable Care Act. This is why this product can work so well for 4 out of 5 groups that qualify. 1 out of 5 groups aren't. And the reason for that is your health wouldn't be advantageous price-wise to be on this style of program, that you'd actually be more appropriate on a fully insured or traditional program. So really the drawback is just going through that health application process and figuring out where your group stands. But from your perspective as employers, that application process, you're never making a decision to join and you're never spending any money. It's simply enabling you to make that educated decision if this is what's right for your organization at that time. If appropriate, we can go down those conversations of what that process looks like. We have nice online options available. We have paper options or a combination of the two. And generally employees can get through that in less than 15 minutes. And there's never any need to go to the doctor or get medical notes. It's all self-disclosure and a relatively simple process.
Well, and I know you said, you know, obviously you can follow up with people individually after this, but the first few of our members that have gone through the process, I mean, they were, I don't know, 25, 30, 70 person shops, a small shop. I mean, they're kind of our traditional members, machine shops. And I know those owners personally, and they are owner operators who are very busy right now with lots of stuff on their plate. And I know they usually bog down with all kinds of customer visits and all that. When I saw the email go through from you to them to say, here's what I need, I mean, it was within a few hours they had all the information to you. So I didn't go through all the information because it's not my, not my information, but it seemed like it was easy for them. It didn't seem like it was too burdensome. They were able to get it to you quick. So it seemed like the process for at least the first conversation was pretty easy and painless. And then, I mean, the feedback from them was that their numbers looked good. I mean, that they were excited. I think one of them was, what, 17% savings, I think?
About 18%.
18%.
Another one was, very similar to what they have, but they're expecting their rates to go up. So, so far, I mean, it looked really good. And again, those small companies that have a lot on their plates, which I know most of us don't love to talk about healthcare, health insurance, and dealing with this stuff. But so yeah, can you just reiterate, I guess, what literally the next steps if someone on this call decides, hey, I'm interested to look at the next step or talk about the next step, what should they do?
If you're interested in possible next steps, or just maybe having more one-on-one conversation to go through what your current benefit design looks like, please send an email to the email address on your screen. That's our general inbox. Or you can send it to me directly. And my email is simply my name, Luke Hahn, at hahnfinancialgroup.com. The materials we need is a basic census. So it's name, age, gender, and zip code of your employees. And then if you offer a current program, a copy of your benefit structure, such as your summary of benefits and coverage. We always try to start with an apples to apples comparison, because anybody could lower your costs with the worst plan design. We at least want to start somewhere similar or even slightly better, and then see if this is worth a deeper conversation that might take a little more time. Ultimately, though, we can help 4 out of 5 employers lower their cost of healthcare. And if you're interested in having that conversation, I look forward to hearing from you.
You're doing right, meeting.
Yeah.
Well, I think that's all the questions we had in the chat function. So really appreciate all of you joining us. As Luke said, you can feel free to reach out directly to Luke. You can also reach out to office@mpma.com too if you have some basic questions. We'll be hosting more of these webinars if you want to chime in again or have someone else from your organization join. I think we'll plan to have this recording available so that you can share it or rewatch it. But otherwise, I encourage you to just take the next step and just get the information, find out what the rates would be, and see if it's a good fit for you guys. So appreciate you all joining in. Appreciate Luke for taking the time today, and we're excited to partner with Hahn. So far, it's been a great relationship. These guys are fantastic to work with, very responsive, and Luke's very knowledgeable. So excited to hopefully help a lot of our members with a plan like this, and look forward to talking to you all very much soon. So take care.